A lot of people actually don't know about the services that psychiatry offers, and they find it actually a barrier to come to get to you. A lot of your patients say, wow, I wish I would have come to you sooner. Hi, and on this episode, we have Dr. Vania.
Hi, everybody.
She's a psychiatrist practicing here in Southern California, and thank you for being on the show.
Happy to be back.
All right, so you've got tons of followers, you've helped so many different people, but a lot of people actually don't know about the services that psychiatry offers, and they find it actually a barrier to come to get to you. A lot of your patients say, wow, I wish I would have come to you sooner. Is that correct?
Oftentimes my patients will tell me it took months for them to call and make an appointment. There's a lot of fear associated with coming and seeing a psychiatrist, which I understand.
So what are they fearing?
Well, sometimes common misconceptions is that we just prescribe medications and just push meds, but that's not the case. We like to explore different possible treatments, non-medication approaches as well that might help them, and also make sure there's nothing medical going on as well.
Do people fear that they might have a mental condition? Is there some stigma around having a mental condition? Is that why they don't want to see you?
Yeah, unfortunately, there's still a lot of stigma associated with mental illness and just the discussion about mental health. But I try and minimize that. And when they come and see me, we just have conversations about stressors and things that have been going on in their life, and just to see if psychiatric treatment is a good option to get them functioning much better.
So what are some of the mental conditions or symptoms that one might want to come see a psychiatrist for?
Well, if someone starts noticing that symptoms such as stress, their mood, sleep, anything that could be impacting their mental health and their ability to function in their day-to-day life and get things done on their to-do list, and they're starting to notice that it's impacting relationships, then it's definitely important for them to come and see a mental health professional or a psychiatrist, especially like myself.
So what can somebody expect when they come see a psychiatrist?
Well, it's pretty much one-on-one. We talk about things such as, stressors going on in their life, specific symptoms that they're experiencing that might be affecting them in their daily life. We talk about family history, because it's important to know if this is something that other family members have experienced as well. And also we go through some of their medical issues to see if that might be contributing to some of their symptoms.
So there are a lot of mental health providers that are out there, some psychologists, psychiatrists. When do people come see a psychiatrist versus another type of mental health provider?
When you see a therapist, in this day and age with our healthcare system, a therapist generally does have more time to spend with you than a psychiatrist does. So a therapist can help you go into more detail and in depth regarding some of your history, some of the stressors that you're experiencing, to help you learn some skills, techniques, coping mechanisms to better address some of your symptoms. Whereas if you see a psychiatrist, we do have a little bit less time, but we're able to discuss and address some potential medical issues that might be contributing to your symptoms to better address your symptoms.
So it's great that you mentioned all these additional factors that affect our mental health. So what should they be prepared to bring with them or be prepared to answer during a visit with you?
Well, I always tell my patients to have their medication list ready. I want to make sure there's no drug interactions or medications that might be also causing some of their symptoms, like making them feel more depressed. Also be prepared to answer questions regarding their family history. Is there a history of mental illness, depression, anxiety, substance addiction, stuff like that that runs in the family?
And you were mentioning how you're sleeping, what are the things you're eating, your alcohol consumption, and how are you dealing with stress, and what are the stressors in your life?
Exactly.
Well, thank you for coming and for debunking some of the myths and the fears of people coming to see a psychiatrist. She's not so scary after all. So remember, there's a lot of things that might affect your mental health and your depressed mood and your anxious mood. And if you've addressed some of those things, including your sleep, including your diet, exercise, stress reduction, all these things, and you're still having symptoms that affect your life, definitely see a psychiatrist or a psychologist or a mental health provider. They're not as scary as you think. Look, I want to thank Dr. Vania for coming again. Where can people find you?
You can find me all over social media, Twitter, Facebook, Instagram. My handle is Freud and Fashion, and I also blog at freudandfashion.com.
Thank you again for watching. And if you have any mental health questions or any actually general health questions that you want answered, go ahead and comment below. And don't forget to subscribe. Remember, you are your best medicine.